are peripheral vascular diseases and what management options are available for them?
Peripheral vascular disease are the disease of large and small vessels or medium-sized vessels, excluding your coronary and brain. It is more common in diabetes, hypertension, smokers, obesity, and old age.
What are the common symptoms of peripheral vascular disease and how do we diagnose them?
This is more common in the lower limb arteries, means infrarenal aorta and lower limb arteries. So most common symptoms, patient will always ask, he cannot walk a distance of half kilometer or 400 meters or 200 meters. These patients usually having diabetes or smoking history or hypertensive history. Patient will complain of pain everywhere, every time. Then there will be critical limb ischemia. That means there will be ulcer, there will be a gangrene, means blackening of the toes, and there will be pale color of the toes. So these are the we will usually see a lot of patients having diabetic patients. They have got ulcers, they have got gangrene of the toes, and this is due to peripheral vascular disease. Simple ultrasound Doppler test, you can see the arteries. So if you are getting any narrowness of the arteries or there is no flow, then you have to do a CT angio or MR angio to confirm. Because previously we are doing a catheter angiogram to confirm the peripheral vascular disease extent. But nowadays you can do a CT angio or MR angio to locate what is the advantage. If CT angio or MR angio will give you the exact location, the extent of occlusion, the extent of narrowing, so that you can directly plan the treatment options.
Who are the eligible patient candidates for interventional radiology intervention?
Doesn't improve after 3 weeks or 4 weeks of treatment and the symptoms worsen, then you should think of an active interventions.
What is your clinical experience on the result and present literature evidence for these procedures?
Standard treatment modality is first is you do a plasty and put a stent. That is the number one point. Second point, BTK, below knee lesions, always you do a drug-eluting balloon or a simple balloon. And if it is a neohyperplasia which is occluding the stent, which is can happen, then you can do a drug-eluting balloon plasty. So these are the simple procedures we usually follow.
What is the message that you want to give to the general physicians about managing the patients in their OPD settings after the procedure has been done by an IR?
So always, any patient having any pain in the lower limb, you should always palpate the dorsalis pedis artery. It is very simple. If the dorsalis pedis artery is palpable to you, then you can exclude peripheral vascular disease to some extent. Patient who is having ulcers, who is having critical limb ischemia like redness or blackening of the toes, you should always think of peripheral vascular disease. You should always palpate the dorsalis pedis and do a simple Doppler test. For any patient having a pain in the leg you are suspecting, do a Doppler test. If Doppler test is okay, then it's okay. So these are the basic points. Early detection will definitely give you good results.